में सब माल आया इसी तरह।
Okay.
दीजिए 1 किलो दीजिए 1 किलो।
Glad I chose to do the shoot when the sun is setting and the temperatures are cooling. It's 30 degrees and humid. I'm feeling it. Hi, I'm Matt, and welcome to an abbreviated edition of Borders on Budgets. This is the Kalinga Bazar in Kolkata, India, on Friday, May the 15th, 2020, day 53 of India's lockdown to combat the coronavirus. So after almost 2 months of a nationwide lockdown, the number of confirmed cases of COVID-19 in India is about 82,000, and the number of fatalities is about 2,700. Perhaps the more important number would be the number of beds, ventilators, and intensive care units. That exceeds 165,000. The country has quadrupled its production, as well as the number of people who are deemed to be severely or have coronavirus on a serious matter is about 10,000. This is my 4th time at the Kalinga Bazar, and I have somehow overlooked this corner stall selling baked and fried goods. I'm coming back here after the shoot is finished. For the past couple of weeks, India has been recording on a daily basis several thousand new confirmed cases of coronavirus, and the fatality count over this count has also been about 100 to 120 deaths per day. It would seem odd that India, after 7 weeks of a nationwide lockdown, that the number of confirmed cases and fatalities are on the rise, if not plateauing, whereas the rest of the world, particularly the harder hit Western nations, the apex of coronavirus occurred in the 3rd week of April. The 6 countries that have been hardest hit, the United States, France, Spain, Italy, Germany, and the United Kingdom, yes, their numbers, both in terms of confirmed cases and fatalities, all seem to have peaked around that 3rd week of April. Meanwhile, with declining numbers, the United Kingdom is only now introducing a 2-week quarantine for anybody coming into the island country, and that government law will certainly put a significant hamper on Britain's tourism industry. The conditions that the hardest hit Western countries have that India does not is that they are colder countries and without as much sun. Whereas here in India, yes, it is crowded, but definitely not cold and with lots of sunlight. So if coronavirus numbers in India are stable, and in Western Europe and North America they've either plateaued or they're on their way down, why the need for continued government restrictions on what their citizens can do? This notion of safety is what is being preached. So on the notion of keeping citizens safe, during my time in Kolkata, most of which has been spent in the hostel, of which there I am safe. I have a bed, I have a fan, I have Wi-Fi, 2 meals a day, and a view of Kolkata. Yes, I'm safe. Am I living? No. And if I knew that this was a long term, because some governments have said they won't lift the restriction until there's a vaccine, keeping their citizens safe but preventing them from living, then what's the point? So with that philosophical idea of the difference between safe and living, I'll let you viewers decide what is appropriate for you. This has been another edition of Borders on Budgets, an abbreviated one at that. from the Kalinga Bazar in Kolkata, India, on day 53 of the nationwide lockdown to combat the coronavirus. Thank you very much for tuning in, and I look forward to seeing you on the next episode.